Hello, everyone. My name is Marina Khreizat. I'm an undergraduate research scholar with the Office for Health Equity and Inclusion at Michigan Medicine. And today I'm going to be presenting our research, understanding the impact of the COVID-19 pandemic on young adults in the health professions pipeline. To give a brief introduction, COVID has greatly impacted students all throughout the health professions pipeline. This includes students having to adjust to virtual formats, move out of their living spaces, and cope with the emotional challenges of the pandemic. Health professional students had to deal with licensure exams being delayed and clinical components of their medical education being retracted. For our study's objective, we aim to assess the academic, personal, and professional impact of the pandemic from the perspective of both pre-health, which is undergraduate, and health professional students. For methods, this is a retrospective cross-sectional study. We created an anonymous standardized survey, which we distributed to pre-health and health profession students from May through September of 2020. The survey was distributed via social media platforms like Instagram and Facebook, in addition to text messaging services like WhatsApp. The survey collected data regarding knowledge of COVID-19 and the impact it has on students' academic and personal lives. Importantly, participants answered a series of 20 questions related to mental health using the Center for Epidemiologic Studies Depression Scale, or CESD. For our results, nearly 60% of the responses came from pre-health students, while over 30% came from health professional students. Of the 224 participants in the study, over half received a score of 16 or higher on the CESD scale, indicating greater depressive symptoms, as shown here on the graph. 75% of participants responded that they were worried about the outbreak and economic impact of COVID-19. 36% of participants reported that someone in their family lost a job, many with no other source of income. For more results, 84% of participants responded that their school adopted an optional pass-fail grading system, with 65% indicating that it had no change on their academic performance. 83% of participants responded that they felt like their institution provided them with enough resources to adjust to an online format of education. For health profession students, nearly 90% responded that the pandemic has not impacted their decision to pursue a particular specialty. In conclusion, the COVID-19 pandemic continues to affect students throughout the health professions pipeline. This includes implications on mental health, educational attainment, and employment outlook. For next steps, while students were provided with resources if they received a CESD score indicating greater depressive symptoms, future studies could assess the long-term impact on mental health challenges associated with the pandemic and the long-term implications on students' education. Thank you.